One.
Okay, so today we're going to be doing an ankle eval. So we're going to start off with history, past and present history. Then we're going to do an inspection, looking for swelling, discoloration, deformity. Then we're going to be looking for palpation, bony palpation. So we're going to be looking for the tib and fibia, the tibia and the fibia. Looking for fracture, the medial and lateral malleoli, looking for fracture. The dome and neck of the talus, looking for fracture. Then we're going to move on to soft tissue. So we have the deltoid ligaments on the medial side of the foot. We have the anterior, middle, and posterior. Then we have the anterior tibiofibular ligament, looking for sprain, and the deltoid ligaments will also be looking for sprain. Your lateral ligaments, your ACF, CF, and PTF. And then you have your peroneal tendons. You're going to be looking for subluxation. Tendonitis and subluxation. And then now we're going to move on to special tests. So now we're going to have the squeeze test. So we're going to squeeze the tibia and fibia together, looking for any pain, and we're going to looking for fracture. And then you also have a calcaneal bump test. So for this, you're going to kind of want to distract them, and then you're just going to slightly tap their calcaneus, and that should feel some pain in the tib and fib. And then we have stress tests. And then for stress tests, if you want to isolate the deltoids and the lateral ligaments, for the deltoids first, we're going to have them plantar flex and then evert their legs. So plantar flex and evert, you're testing your anterior deltoid. The neutral and everted, you're testing your mid deltoid. And then dorsiflex, you're everted, you're testing your posterior deltoid. And then plantar flex again, and inverted, you're testing your ATF. Neutral and everted, you're testing your CF. And then dorsiflex and everted, you're testing your PTF. And then you have, of course, ankle inversion, you're testing your ATF, CF, and PTF. Ankle eversion, you're testing your deltoids, anterior, mid, and posterior. Then you have your anterior drawer test, you're testing your ATF and anterior deltoid. And then posterior drawer test, you're pulling down the calcaneus and stabilizing with your hand. And for that, you're just looking for PTF. And then you have range of motion. Then we have passive and active. But I'm going to be doing passive today. So you have ankle dorsiflex is 20 degrees. Ankle plantar flex is 50 degrees. Ankle inversion and eversion is both 5 degrees. So next we're going to move on to stress resistive range of motion. So resist to my hand wherever I place it to. And so first we're going to do ankle plantar flexion. So it's going to push down, and that's your gastroc and your soleus, and that's both your tibial nerve. And then pull up. That's ankle dorsiflex, and that's your tibialis anterior, and that's your deep peroneal nerve. Then ankle push inside. That's ankle inversion. That's your tibialis posterior. That's your tibial nerve. And then ankle eversion is your peroneus longus and brevis, and that's your superficial peroneal nerves. And then we have motor and motor. So for motor, you're going to copy the same thing I do. So L4, we have ankle dorsiflex and eversion, and then L5 toe extension, and then S1 ankle eversion, and then S1 to S2 ankle plantar flexion. All right, and then now we have sensory. Now we have sensory. So we have L4, L5, S1, and then we have reflex. So we have Achilles tendon. You tap in the back. You have their scoot up, please. Have their leg at 90 degrees, and then you're going to tap with the reflex hammer back of the Achilles, looking for reflex. And then now you're looking for blood flow test. You have your dorsal pedal artery pulse, and then recapitalization test, and then you bilaterally compare.